to This Day. Today is Monday, March 30th. And as we have been doing for you the last week or so, we're going to go ahead and only have a half-hour program today till 9:30, but we've got lots of information for you today. So today on our show, we have Jeff Parker, who's going to be here with our usual update. There have been some developments over the weekend, and he's going to bring us that information. Then we also have Broadway in Your Home. Now, Broadway in Your Home is basically just going to tell you a little bit about where you can see Broadway shows without leaving your couch. Then we also have music concerts in your home as well. We've got a couple of links that are going to allow you to see musical concerts, jazz, classical, and a couple of other really fun ones. Then I'm going to bring you some hospital resources so you can have those at your fingertips if needed. Now, let's go ahead and remind you of all of the resources that you have available to you. Of course, you have the ochealthinfo.com/novel coronavirus. Then you've also got the other website that we have, which is the OCCOVID19.ochealthinfo.com/coronavirus NOC. I know that's a long one, but if you want to get right to those numbers to see what's going on in each city, that is the website you need to go to. Then we also have the OC Health Department line, which is 800-564-8448. And then you could go to the OC Health Department, which is 833-426-6411 if you have any direct questions regarding that list. Then you can go to our information, which of course you could always email us at info@lagunawoodsvillage.com. You could go to lagunawoodsvillage.com website and you can click on our coronavirus update button. You can see that right in the middle. And then of course you could go to our recorded hotline, which is updated regularly, 649-268-2019. Now let's go ahead and take a look at our weather. We have some gorgeous weather. Hopefully you were able to enjoy some sunshine this weekend and get some of that vitamin D that we so desperately need. We've got sunshine today, 71-52. Warm high clouds tomorrow, 75-54. Then Wednesday we have again a nice day with some high clouds, 71-57. Then Thursday it's going to be pleasant with some high clouds, 68-53. And then by Friday again, sunny, 71-54. So it's going to look really good this week, so stay tuned. We'll be right back with Jeff Parker.
Hey, thanks for coming in on the weekend. It's not much, but I brought you a donut.
Oh, thanks. I already got one. Oh, it's AARP. Let me just...
Wait, are you joining AARP?
Actually, I just did.
Really? But you're not...
What, eligible? Yeah, I am. You are too, Mr. 50.
Well, yeah, technically, but I didn't think we were ready for AARP.
Then I guess you're not ready for all this.
Okay, I hear you. But is it worth it?
You tell me. I enrolled at 7:02, saved on concert tickets at 8:10, read a great article on investing at 9, found a sweet travel deal at 10:15. I used the caregiver finder for my dad, and done. Discounted movie tickets.
Hey, check out this great office stretch I found. I didn't know AARP offered all that. How much to join?
See for yourself.
That's all? For a year?
Which includes?
The donut.
Free with my morning coffee.
No way.
If you don't think instant benefits when you think AARP, then you don't know ARP. Join today for just $12 and get discounts from eye care to travel to entertainment. So many ways to save. Instant resources, tips, and tools to help manage your money, maximize your health, and so much more. AARP is mobile. Just the right offers find you at just the right time. And we hear you, so your voice will be heard. The world of AARP, yours today for just $12 for your first year, and that includes your spouse. And a subscription to AARP the magazine, plus this travel bag absolutely free. It's not too soon. Don't miss out. Join AARP today.
Call 1-800-748-6813.
And join AARP for just $12 for your first year. You'll also get this travel bag free when you join.
Call 1-800-748-6813.
Or visit tryaarp.org.
Welcome back. Thanks for joining us and staying tuned. We have Jeff Parker here who is going to give us an update. As I mentioned earlier, we do have some new developments from over the weekend. Well, welcome back. Hopefully you got some sunshine this weekend.
Good morning, Lisa. It's a pleasure to be here.
Okay, great. So let's talk a little bit about the difference between an essential and a non-essential employee. I know some people are kind of wondering, what really is an essential employee?
So the regulations that came from the state of California and the federal government tried to categorize what was an essential service that could continue. Public health and safety obviously being the key one. So like our security operations clearly falls under that category. But we have a number of them. I'm just going to list them real quick. We have our security operations, our gate operations, obviously, but also our resident services, the need for people to call in if they have an emergency, if they have a plumbing leak or any type of activity like that. We need to be able to get out there and take care of it. So our plumbers, our electricians, although we've slimmed down that crew to some degree, those are critical needs. So we have staff working full-time on that. We also have staff working in our manor alterations if we've had a water intrusion or any kind of activity like that. And contracting has been another one that has been real interesting. Should contractors be able to continue to work? And we said, well, let's check with the city and see if they're still issuing permits. Where there's permits been issued for work that's ongoing, we've said we'll allow that to continue, but we're not issuing any new activity permits relative to the village.
Right.
So that's kind of those key critical. And then we determined based on the criteria set that landscaping was a critical one. Continue to maintain our operations so that it doesn't deteriorate. So that being an essential. And then communication via an administration. What we're doing, you and I sitting here, TV6, a critical element of giving the news and information out to our residents is critical to being successful here in the village.
Well, and I'm glad that you did decide to keep TV6 going, because when you look at the news, much of it is not really covering Orange County, it's covering Los Angeles. And so it's good that we can give you some general information here locally.
Absolutely.
So thank you. Also, there's some real estate, some new news from the federal government about real estate services. What is that?
They just added to the list of, again, essential services, real estate as an activity, which is important to the village. We realize that. But we're still going to take the position that we don't want to see open houses during this time period. Because we think that bringing people into the village and having people get together, and if you have an open house, that means people are going to the same location. That distancing issue, the requirements that are being set up by the federal government to keep that from escalating. We think that open houses aren't necessary. You can still contract the operations of a real estate agent. You can do virtual real estate activities, and certainly you can move forward with the package that you need to do with a real estate agent without seeing an open house. So we're going to continue to deter that and indicate to our real estate friends that we have in the community, we just don't want to see open houses to continue. Right.
Okay, good. So some people have grandchildren or children here, and you're noticing that there's some people that are congregating in various areas of the village. So what kind of messages would you like to let them know?
Well, most important is that we have regulations now from the state and federal and local officials to watch the social distancing. And what we've found is we've gotten calls that people are still out there in groups and activities. They're standing around talking, or they're doing some type of activity together. We have a number of people over in the creek area, but we had some people at the clubhouses that were showing up, and we just have to maintain this social distancing as a priority. The village has done a great job. The residents here have done a wonderful job of hunkering down in their units, and that's really, really great. But I know there's a desire to get out, but you need to get out with the social distancing in mind. If you're going to take walks, take walks by yourself or with a friend, but again, keep that social distancing. But if you go out in a group, you're not going to accomplish that. And so we're just trying to let everybody know, don't be out in groups together, at least not in the village, because that's the highest risk area.
Well, exactly. And then the other question is, when you're within a family unit, and they're all living in under the same roof, though, there has been discussion that is okay as long as that group isn't near another group that's in a separate household, correct?
And one of the things that has come up recently in that dialogue is, as long as nobody's sick in that group, the reality now is that you need to social distance within your family if somebody starts to show the signs of it, because it can just spread among all the family members, and you don't want to do that because that just puts more stress on the health programs that are out there, the hospitals or the doctors that are having to treat people. So it's too easy to spread. So you need to isolate in that kind of environment.
Exactly, exactly. Virtual activity. So you mentioned earlier that we can still operate virtually with real estate agents, and we've been incorporating now some interviews via Zoom, so we're doing a lot of virtual things.
Right.
So it sounds like, we are looking at an extended period of time now where we're going to have to be sort of stay at home. So what are some virtual things that you guys are going to be offering?
I mentioned before that we're going to start doing our meetings, our board meetings with via virtual process. And so that will be GRF. It's our first board meeting on the 7th, and that one will be done virtually. And so we're getting that all set up with GoToMeeting is the system we're going to be using. And so we look forward to that challenge and opportunity, though, to get re-engaged with our community and the activities that the boards are still doing.
Okay.
So that's real important. But then on a expanded part of our activities, we want to look at some new recreation programs maybe that we can offer virtually. And so we're looking at how we can go out and get some of these taped and get them on the programs so that people can see that on Channel 6, obviously, and so that people will have things to do on the weekend besides just sitting there and watching movie after movie.
Yeah, I know, because we were just discussing what we did over the weekend. We got caught up on some of our series that we didn't get to actually see. So that's good. Well, that's exciting because I think it's very important. Number one, for people to learn how to use the virtual capabilities, and hopefully we'll be able to walk you through some of those things. I know we've been very successful with Zoom, so hopefully we'll be able to have some sort of idea of how to use that, and maybe that's something that we'll be able to use going forward, or as you mentioned, maybe just through Channel 6. So.
And when we come up, like I said, the 7th is next week, so either Wednesday or Friday, I'd like to come on again and maybe explain how the GoToMeeting works. If not, we'll get Chuck Holland on here and have him explain how we're going to do that, how people can interact with that by sending emails in if they read the agenda and they have a question, and we'll set that program up so people can be engaged.
Yeah, because that's going to be a question as to whether or not we air that on Channel 6, or is that something that's going to have to be on an online thing? So we'll have to.
We want to do both. We want to have it so people can email us while the meeting's going on, but we want to at least have the agenda and everything on Channel 6 as we're meeting.
Okay. Oh, good. Well, hopefully that'll all pan out quite quickly. COVID-19 information over the weekend, as I mentioned earlier, there has now been an extension of about 2 weeks for us to be at stay at home. So I'm sure people are probably a little frustrated with that, yet this is something that has to be done. So what are some of the things that you're recommending, and what did you find out this weekend?
Okay, so 2 things that I wanted to mention. First of all, when we first started to close some of our facilities, we said that we would evaluate in a 30-day period, but we would take these next 2 weeks to get into a more detailed evaluation. And obviously, before that occurred, although we're getting ramped up on that, the president has indicated that he wants to have the stay-at-home position go through the end of the month, through the April, all the way through so that's the 30 more days, obviously. So we're going to take that evaluation, and then I'll come back on Friday and tell you what we look at down the road. I'm not sure the 30th is going to be the end-all, be-all, as we've seen those numbers keep changing and moving, but we're going to take that evaluation. So our next step is, how are we going to continue our operations? What's going to be key to being essential and non-essential, and how we're going to handle all our employees with regards to that.
Right.
Second thing I wanted to mention was Orange County has a new website. We did mention it the other day. And on that website at the Orange County Health, they are actually now posting numbers, which they hadn't done before. So they're posting cases with regards to any community over 25,000 in population. Now, we're not. Unfortunately, we don't fall in that category. And a number of places don't. Laguna Beach doesn't either.
Wow.
And so when you go on that website, what you're going to find is all the cities listed, and then you're going to get down and it's going to say other.
Yeah.
And we are other.
Right, right.
And in that other, it counts unincorporated areas, cities that are under 25,000 in total, that comes up to a population base of 200,000 people. And I just wanted to mention that in that 200,000 area, they've had 40 cases reported.
Okay.
So to date, there have been 431 cases. This was of yesterday.
Okay.
431 cases in Orange County
As a whole, okay.
in total. Unfortunately, 4 deaths in the county, and they had 28 cases reported yesterday.
Right.
What we know, based on all the scientific knowledge and everything that's going on that we're starting to see a growth in these numbers for a couple of reasons. One, just the kind of the incubation period of the virus in and of itself and how it spreads. But number 2, more and more testing.
Exactly.
And as we get more and more testing, we're going to get more and more confirmation of cases out there. So this next 2 weeks is probably going to see a big spike in California.
Right.
And that's a serious concern. So this stay at home, this be protective of yourself, wear masks, wear gloves. If you're ever going out and if you're going to the market, protect yourself in that environment. It's the best thing that we can tell people. And keep your activity at home as much as possible.
Right, and wash your hands. I mean, have we
Yeah.
all, I mean, we've all always been washing our hands, but
and
now
don't-
we need to do
and
it
don't
even
touch
more.
the face.
Don't
That's-
touch your face. No, that's true.
Yeah.
This weekend there was an awful lot of, coverage, of course, a variety of different things. And, New York being the one that we've been looking to kind of get an idea. And it seems like it's, going coast to coast, and then it'll, kind of go through to the middle America. However, our local hospitals are ramped up. Particularly, I know Kaiser Permanente started the drive-through testing, and then Saddleback Medical Center and a variety of others are right behind them. So they are preparing, and that I will be giving you more information later in our broadcast about hospital information and where they can get that information. So.
And I think that's wonderful for the county. I think, in fact, from the hospital standpoint, we're probably in better shape than many counties are, and we just need to encourage people to get tested if they have the symptoms, get to their doctor to find out if they can get tested, number 1.
Right.
And then quarantine yourself if you feel like you're having the symptoms. Don't spread it around with anybody else in your family.
Exactly. Anything else?
No, those are the highlights for today. I'll be back on Wednesday, obviously, with some more. And then on Friday, we'll have maybe a bigger presentation with regards to where we're going down the road with the activities in the village.
All right, great. Well, thank you for all the information.
Thank you.
All right. And remember that resident services is available to you, so you can call your resident service if you have certain issues, as he mentioned, with plumbing and things like that. So make sure that you still make that phone call if you do need help. We'll be right back.
Hello, I'm Barry Arbuckle, President and CEO of Memorial Care. Our country, our state, and our local communities are deeply concerned about coronavirus, COVID-19. In an 8-day period, the World Health Organization declared the coronavirus a pandemic. Our president declared a national emergency, and our governor issued an executive order for all of us who can to stay home. Of course, our community is shaken. Let me offer some reassurance. We live in a community that offers exceptional health care close to home. Whether you seek care at Memorial Care or another health system, you're getting among the best the world has to offer. Our doctors, nurses, and other clinicians are trained to manage these types of illnesses. It's what they do every day. Thank you to our thousands of employees and physicians for the care and compassion you're delivering to our patients and to each other as we manage this pandemic. I'd like you to hear from Dr. Jim Leo. He's Memorial Care's Chief Medical Officer with board certification in internal medicine, critical care, and emergency medicine.
COVID-19 is a new disease, one that has not been previously seen in humans. And while we don't know everything about COVID-19, there's much we do know. First, the symptoms are generally more severe than typical respiratory infections. The most common symptoms are fever, cough, and shortness of breath. COVID-19 can also cause sore throat, diarrhea, and muscle aches. If you think you've been exposed and develop these symptoms, call your doctor for medical advice. The Centers for Disease Control recommends that you do not go to the emergency room or urgent care center if you have mild illness. Instead, you should self-isolate at home. Emergency warning signs requiring immediate medical attention are difficulty breathing, persistent pain or pressure in the chest, confusion or inability to wake up, or bluish lips. If you have any of these symptoms, go to the nearest emergency room or call 911. What can you do? These 7 things can't be said enough. Follow our governor's directive to stay home if you can. Practice social distancing by allowing at least 6 feet of space between you and another person. I can't emphasize enough how important this is. People can spread the COVID-19 infection for days before they develop symptoms. So by practicing social distancing, you're protecting yourself and others. Wash your hands often and always before eating. Use soap and water for 20 seconds. Don't touch your eyes, nose, or mouth without washing your hands first. If you sneeze or cough, cover your mouth and nose with a disposable tissue, then wash your hands. Or cough or sneeze into the crease of your elbow. Regularly clean and disinfect frequently touched surfaces. Never share food, drinks, or utensils. Thank you for doing all you can to keep yourselves and others healthy.
Be assured that Memorial Care is taking every precaution possible to prevent spread within our hospitals and outpatient centers. We're limiting entrances and screening those who come in and out, temporarily limiting visitation to only certain circumstances, postponing elective surgeries, and many other measures, including converting many of our office clinic visits to video. We believe these actions we take together will help prevent further spread of infection. Still, we must take measures now to ensure we are prepared for any increase in patient needs over these next few weeks. We are collaborating with governmental agencies and other health systems to ensure we are ready for what may come. For now, stay home if possible, enjoy time with your family, and if you know someone who doesn't have a family or the support they need, check in on them and ask how you can help. We are all in this together. Thank you.
Welcome back. Well, our team here at Village Television Channel 6 have been scouring the internet and television and a variety of other resources to bring you some very interesting ideas. So as I mentioned earlier, we found a source for Broadway shows that you can watch right in your own home. So we have prepared a couple different resources for you. So let's go ahead and take a look at Watch Broadway from your home. So Broadway HD is offering a large collection of productions from New York City and London West End theaters. So for instance, the library features approximately 300 shows, including Cats the Musical, some of Shakespeare's greatest works, ballet productions, and more. Broadway HD collection is refreshed monthly. Now, it does have a fee after a 7-day trial. It's $8.99 per month. But you know what? If you are a regular ticket holder at Segerstrom or some of those others and you can't get to the theaters right now, that's not such a bad deal. $8.99 for maybe 2 of you is a pretty good deal. So if you are interested in going to get this, you go to BroadwayHD.com and you can follow the instructions there to go ahead and sign up. So that sounds like a really great opportunity. Then the next one that we have is called Actors Fund. Now this offers miniature Broadway shows every day, but interestingly, it also has actors that come on periodically and they have kind of a Zoom thing going on like we did last week. It's at 2 and 8 p.m., features stars like Kristen Chenoweth, Patrick Wilson, and Audra McDonald. They are free and they are asking for donations, so if you'd like to do that. Now that is on a YouTube channel, so you would go to youtube.com/user actorsfund.org/videos. However, I suggest just go to youtube.com and type in actorsfund.org and you'll get right to it. And the last thing that we found is, of course, Netflix. Now Netflix has offered so many different things. But one thing that's kind of nice is they are offering a free 30-day trial, no promo code required. So if you normally don't have Netflix, that might be something you should look into, netflix.com. And again, that will bring you some Broadway show features as well as some musical performances. Now let's go to our other one, which is musical concerts. And I don't know if I'll have time to go through the entirety of this, but I'll tell you that today, March 30th, and tomorrow, March 31st, there's going to be a jazz concert. Now, this is on Facebook, so it's a little bit different. If you don't have Facebook, you can always sign up for Facebook. It's free. And you could type in the URL portion, says Fred Hirsch Music, and that will be at 1 o'clock today, and then we'll bring you a jazz fest. Then at 10 o'clock in the evening, that's actually the Eastern time, you will be doing live from home, and that's the San Jose Jazz. And again, that is a Facebook link, San Jose Jazz. So that's what we have for you Monday and Tuesday. So go ahead and check that out. And then tomorrow, we'll bring you some additional resources regarding more musical opportunities. So let me go ahead and just get to our hospital resources really quickly, and it's just a slide that will tell you all of the regular information that you will be able to have at your fingertips. So we have Memorial Care Saddleback Medical Center. Their website is memorialcare.org. So that's super simple. So if you want to find out what are some of the things that you can do with them, either testing or you want general information about how to go about talking to your doctor about maybe whether or not you have COVID-19, you can get that all at memorialcare.org. Kaiser Permanente OC, kp.org/Orange County. And again, you can get all that same information there. And as I mentioned the other day, the top of their website has the COVID-19 information. Hoag is hoag.org. And then City of Hope, if you have information or you have questions about how to go about utilizing their facilities, probably not for COVID-19, but maybe for regular services, you go to cityofhope.org/Newport Beach. Now let's take a look at our weather one last time. It's going to be a beautiful week. Looks really good, sunshine, so make sure you get out there and get some of your vitamin D. Highs are in about the 70s, low 70s. Tomorrow is 75, going to be a little warmer. Then by Friday, it's going to be 71, 54. So to have a great day in the village, and we will see you back here again tomorrow at 9 a.m. Thanks for watching.
As a mother and a wife, I understand how challenging this moment is for our families and our communities. That is why our state is responding at every level of government to slow the spread of COVID-19 while ensuring our most vulnerable Californians have what they need. But we can each do our part, and it starts by staying home. I know this is a big sacrifice for so many, but staying home saves lives. Learn more at covid19.ca.gov.